Caroline Sai. I'm head of the EIT Health Investor Network. It is operated by Angel Santé, that I am head of Angel Santé as well, which is the largest business angel network dedicated to healthcare investment in Europe. I think it's super valuable. I mean, we know that in Europe, the markets are very fragmented, both as markets, reimbursement markets, but also the whole healthcare systems. They're all individual systems, and it's very difficult for a startup to be able to maneuver in Europe and have a deep understanding of each healthcare system. So having an accelerator that gives them the opportunity to meet partners, to ask their questions, and to really get a deep understanding of the market that they're targeting is super useful.
My name is Jean-Marc Bourez. I'm the EIT Health France Managing Director. A good momentum and a really great opportunity for these startups operating in the digital areas or digital therapeutics or artificial intelligence domain.
Having a better understanding of how the fundraising is in France compared to the Swedish environment is super useful, because they will be faced with competitors that may have more public funding, maybe have more specialized investors ready to invest in their projects. And so they have to understand what they're facing when they're coming to the French market. And if they do want to find French investors, which will be useful for them to open their network and get access to maybe partners that they wouldn't have, they need to really understand what French investors expect compared to Swedish, maybe more agnostic investors.
So the Swedish French Accelerator is really a great opportunity for the Sweden companies regarding the strategic innovation partnership that has been agreed in between the Swedish government and the French one. And this program is fully supported by the Health Department of the Ministry of Solidarity and Health, gathering as an example the Genius platform as a services to support the development of these companies in France. Due to the fact that we are dealing with our members and partners that are fully committed to make it happen and to support the development of these companies in France, such as industry partners, academic partners, universities, health data hub, and some other type of mentors and coach that will support the development of these startups in France. It's a one-way track, it's a pilot program, and we do expect that it will be a success to scaling up this type of acceleration program within EIT Health.
Well, one of the obvious difference is the number of regions in Sweden. There are 11 regions, and each region requires a healthcare startup to go and ask for their reimbursement. Very difficult. 11 million people, 11 regions, that makes it, a small cake and tiny slices of cakes that you have to go after. In France, it's difficult and complex to get reimbursement, but once you do, you've got one single market, at least in France. And France is currently looking closely at a similar system as DIGA in Germany to facilitate digital health solutions and their reimbursement.
So that represents a huge opportunity for these companies to deep dive into the French ecosystems and being able to moving forward throughout this type of market access opportunities, putting in place a randomized clinical trial to validate their solutions with academic partners or research organizations in France with university hospitals. So the validation of their solutions will move forward throughout a new framework of evaluation and a concrete reimbursement model that will be implemented in France in the upcoming years.
only thing I would advise them is to really enjoy this accelerator, ask as many questions as they have, and really do a broad, deep dive market survey. Because if they want to sell to French consumers or hospitals or whatever, they need to clearly understand the difference between the French and the Swedes. There might be none, but there might be a lot of differences to how you approach the customer, how you have to pivot a little bit in your business model, or even how you have to modify your product to really be what the end user here in France needs compared to Sweden.
So my top advice, be patient. You are in a trusted relationship with our partners and with our teams in France and in Sweden to help you to pave the way to succeed.